Hey. Everybody has the package. We are going to start endocrine system, and I gave 3 packages, and this one I will be going over. That's the main package with the endocrine. Then I gave you the questions from Lippincott. Practice your question. The 3rd package I gave you the drug package, and that would be some insulin there, thyroid medication, steroids, and I'll go over on that a little bit at the end. I will start. I know endocrine system we feel hard, but let's learn in a right way, because we must connect how our glands function. And what is endocrine glands are? Endocrine glands are, the glands are producing hormones. And where are the hormones are going? In endo. Endo means directly in the blood. Are we clear? Now when we say the word exo, exo means outside the blood. And when we talk about some of the problem in the body, we have like your exocrine glands and endocrine glands. So we are talking about endocrine glands. So what is endocrine glands are? The glands are producing, what are they producing? Hormones. What these hormones does are affecting our whole body. And we must relate those, because very important when we are taking care of our patient, as well as when we are taking care of different diseases and surgery, and how does it affect. So it's very important that we know where is our glands are. So I'm going to start. The first one, it says you basically have everything here, but when I will say something, make sure you write it down. So don't confuse. Main thing, remember, understanding. So where is our pituitary gland? In your notes, you have the first line, in the brain. So underline the word pituitary gland is where? In the base of the brain. Very important word. And underline the word master gland. Remember, what is a master? Master for our body. Master of other glands. That means it affects. You don't have in your notes, but I wrote it down here. It's very important that pituitary hormones are, there are 2 parts of pituitary glands. Anterior and posterior. Anterior is producing a lot of hormones. What are the hormones are producing? I wrote it down here. You don't have that in your notes, but I want you, if you cannot memorize, but very important that we all know that anterior pituitary gland affecting is, I wrote it here, is pituitary gland. Then you guys have anterior pituitary glands. And anterior pituitary gland is responsible for growth hormones. Very important is what is anterior gland is responsible for growth, number 1. And what is growth means is here, we will talk later. Second thing is adenocorticosteroids. Now it says adenocorticotropic hormones. And where is it affecting? Adrenal gland. I will be talking about later adrenal gland. So everyone, just pay attention when we are going over here. Otherwise, you will not understand. I want you to understand, number 1, anterior pituitary gland is responsible for what? Number 1, growth. Number 2, this is important that you, as I move in, then you write it down. Go adrenocorticotropic hormone. What is adrenocorticotropic hormones are affecting where? Adrenal gland. Are we clear? And what is adrenal gland? Remember, I will be talking about the Cushing and Addison. So Cushing is affected. Number 3, thyrotropic. What is thyroid means is thyroid gland is affected. Number 4, gonadotropin hormones means ovary, and in the male, it affects spermatogenesis. Everyone is okay? Where is your pituitary gland is affecting growth all over. And what are the growth hormones is affecting? We will be talking. Number 2, it affects where? Adrenal gland. And number 3, thyroid gland, and number 4, sex hormone. So when we are growing, it affects all over the body. Everyone is okay? So what is your anterior pituitary gland is responsible for is growth hormones. Everyone all right? What is anterior pituitary gland? Growth hormone. And what is the part of the body is affected on growth? Your adrenal gland and your thyroid gland, your sex hormones. We all are growing, not only one side, but we are growing all over. So remember, your pituitary gland is the master gland, and what does it affect is the growth hormone. Now, second part of the pituitary gland is posterior pituitary. What is posterior pituitary is ADH and oxytocin. Now let's go on our papers here. On pages, first page, I want you to highlight everyone, underline the word. Where is your pituitary gland? In the brain. Everyone is okay? Where is your pituitary gland? In the brain. What is it? It's a master gland. That means it does affect all over the part of the body. Next is number 2, influenced by hypothalamus. Underline the word. And underline the word growth of body. And write down anterior. And water absorption by the kidney are posterior part of the your pituitary gland. Anterior pituitary gland, highlight the word growth hormones. So remember, when we are saying growth hormones, every gland is going to be hypo and hyper. Everyone is okay? When we are saying pituitary gland is hyperpituitarism. What is the meaning? Hyperpituitarism. Underline. They have too much of growth hormone. Everyone is okay? What is hyperpituitarism? Is too much of growth hormone. And what is too much of growth hormone? We are too big. And what is the word is called here is acromegaly. And underline the word. When is acromegaly? Is in adult. And gigantism, I wrote it down here. Hyper. In hyper, we must know acromegaly and gigantism. You guys have in your notes. So that is hyper. Hypo, when we are saying the person is shorter, is called dwarfism. Are we okay? So what is two part of the pituitary gland? I said anterior for the growth. What is growth means? Either we are too big or we are too short. But not only by looking, remember it's a master gland is affecting the growth hormones. Next one, we are going hypopituitarism. What is hypopituitarism? Underline the word dwarfism. So what is your growth is? Number 1, how do we grow from what gland is affecting? Pituitary gland. Where is our pituitary gland is? In the brain. And when you are too big, everyone should know when we are adults and too huge person is called acromegaly. I wrote it down here, which you don't have in your hypo. Everyone should write down the drugs. What do you give when person is hypo? They're dwarf. So what do you give medication are? I wrote it down, is the growth hormones. And the name of the drugs are Somatrin. Somatrem. Somatrin. And number 2 is somatropine. This is the second name of Somatrin. And somatropine is the other medication. So who you are giving somatropine or is somatrin? These are growth hormones. So any question comes, when we are giving growth hormones, which patient are we giving growth hormones? Those who need more to grow. And what is the patients we call dwarfism? Everyone is all right? What is the anterior pituitary gland is responsible for growth hormones? What are the 2 growth hormones? I wrote it down, the medication. Somatrin and also somatropine. And growth hormones you are giving for which patient? When we use the word hypopituitarism. What is hypopituitarism means is the person is very shorter, and dwarfism you are giving growth hormones. When you are too big is called, I wrote it down here, hyper. What is hyper are? acromegaly, and gigantism. And acromegaly is in the adult, and before puberty, we use this word. They can give that medication to stop that. And that can be Paraldol, you guys write it down, Dostinex, those two drugs you're giving for which patient here? In acromegaly. These two drugs are to improve their growth. So that is a growth hormone. And gigantism, when you have person or acromegaly, they can give the medication. But what happened? They're too huge. They're not going to get better, and they don't want to get worse. So they got to do the surgery, and they're removing the pituitary gland. Now, let me repeat here. Now, make sure we are listening more carefully. You can always add it, you can write it down, but understanding is very important. So first thing I said, where is our pituitary gland in the brain? Everyone is okay? What are the two parts of pituitary gland is? Anterior and posterior. What is anterior is responsible for growth. Everyone is okay? What is anterior is responsible for growth. And I said these are all the growth affected by anterior because we are growing. We are not only growing by height, but your hormones are there. So what are we affected here? The growth hormones, number one. And number two, your adrenal gland. Number three, your thyroid gland. Number four, gonadotrophin hormones. That means your pituitary gland is the master gland of our body. Everyone is okay? So when you are shorter, what is it called? Hypopituitarism. When we are bigger, they will use the word hyper. So when they said hyper, what does it mean? What is hyper means? Person is too big. And what is the disease is called? Acromegaly. Everyone is okay? Acromegaly. And what do you do to help that person? Drugs. I wrote it down here for acromegaly is Paraldol and Dostinex. Those two drugs, I wrote it down here. But what would be the treatment for them would be, we will talk about a little later. Let's highlight the main wording on your first page. Pituitary gland, everyone should know in the brain. Second thing, I ask you to highlight the word growth of the body. And what part of the growth of the body, what gland is that? Anterior, right down there. Anterior pituitary gland. Water absorption on the kidney is done by posterior pituitary gland. Then you will go underneath is anterior pituitary gland, and it says there growth hormones. Everyone is okay? What is anterior pituitary gland is responsible for growth. Either we are going to be shorter or we are going to be the bigger. So it's a package here. It says endocrine system. That's the package you look for. And that's what I'm going over. And so it says anterior pituitary gland has growth hormone. And hyperpituitarism means acromegaly and gigantism. When we are saying hypo means dwarfism. How do you treat them for dwarfism patients? Let's go treatment. You give them growth hormones. What are the growth hormones? I wrote down the name here, somatrin and somatropin. Those are two hormones are for a person for growth hormone. Now, if they give you a question, patient is taking somatrin, that means it's a growth hormone. Or they may give you a question, patient is taking growth hormone. What do you monitor? Let's underline the word when you're giving growth hormones is in the evening. First thing is the best time to give them in the evening. Second, highlight the word hyperglycemia. What is hyperglycemia? They may not give hyperglycemia and they may say, what does the patient complain? Polyuria, polydipsia. So everyone is okay. Dwarfism patients, how do we treat them? By giving growth hormone. What is the best time we give growth hormones are in the evening. What do you monitor when you are giving growth hormones? Everyone should know hyperglycemia word, or they may say, they may not give hyperglycemia, polyuria and polydipsia. Those are your symptom of hyperglycemia. Everyone is okay for dwarfism. Then you go hyperpituitarism. What is hyperpituitarism? Are hypersecretion of growth hormones. Immediately when they're saying patient has hyperpituitarism, person is going to be big, and that is called acromegaly. Underline that word. And acromegaly, and second line, Cushing. Why? Remember here, I said that's a master gland. And what is your adrenocortical is affected adrenal gland. What is adrenal gland disease? I'm going to talk about Cushing. Now remember, you guys, what is Cushing is? Moon phase and buffalo hump. So indirectly, this is your master gland, is affecting all over your body. So not only we are saying acromegaly, is all the hormones are affected. So if ever you see in question with a patient with adrenal gland and Cushing, and maybe in Cushing surgery can be done removing pituitary gland, or pituitary gland is affecting as Cushing. Everyone is okay? Hypersecretion of pituitary gland is affecting what? The growth. Everyone is okay? So what is growth means is acromegaly, and underline the word Cushing. Why? Write down the word because it affects the adrenal gland. Now next is data collection for acromegaly. What is the data collection for acromegaly are? They're huge person. They're big, large hand and feet. Second word, very important, organ megaly. You are not only growing outward, but you are growing inward also. So what is the meaning organ megaly? All the organs are affected. What are the organs are affected? Heart, your liver, all the organs. So that means person not only physically, but their hormones, the organs are affected. Everyone is okay? What is acromegaly are? Is hypersecretion of the pituitary gland. Everyone is okay? They give you a question. Patient is admitted with acromegaly. Who we are looking for acromegaly is the pituitary gland. And what is pituitary gland? Hypersecretion of pituitary gland. Underline the word hypertension. After organ megaly, a lot of question can be cardiac problem. Hypertension, and they have problem with dysphagia, swallowing, and underline the word with swallowing problem are soft diet, chewing problem. We are not looking the symptom, but think about if you have a patient who is admitted with acromegaly, what would you do as a nurse? Number one, we said is swallowing problem. Second problem, chewing problem. Cardiac problem. Then dysphagia. If they have dysphagia, you give them what kind of diet? Soft diet. So highlight that word. Arthritic changes. Their bones are bigger and they're very painful. So when they're walking, they will have pain medication. And remember, the safety is number one when we're dealing with our patient. Then visual. Because optic nerve, because of the bones are bigger and they are affecting the eyes, the nerve, and so they have problem vision. Next, you will move on to the skin, hypertrophy skin. Maybe we need to take care of the skin. Amenorrhea, sex hormones are affected, and maybe affecting with them is amenorrhea. Now, intervention. I wrote it down for acromegaly. These two drugs we can give them to help them, which is called Peraldol and Dostinex. These two drugs are given for acromegaly. So please add there acromegaly underneath when we are saying hyperpituitarism and intervention, emotional support, skin care, and write down the medication. Two medication can be given is Peraldol and Dostinex. But what is the main treatment is here would be surgery. Underline the word. Is called is second line hypophysectomy. I wrote it down here. Acromegaly patient are going for what? Surgery. Hypophysectomy. What is hypophysectomy is removal of pituitary gland. Everyone should know. Because when we are getting questioned or your patient is coming, and yet they're not saying removing the pituitary gland. Your questions are going to be, patient is admitted with what? Hypophysectomy. Everyone should know what is hypophysectomy? Pituitary gland. Where is your pituitary gland is? Everyone is okay so far? Is in the brain. Everyone is okay. Where is your pituitary gland? In the brain. And what is the pituitary gland does? There are two lobes, I said, anterior and posterior. What is anterior is doing? The growth. What is posterior is doing? Remember, I wrote it down, ADH. Are we clear? Now, so those are very important, and everyone, acromegaly is the patient and done going for surgery for hypophysectomy. How do you do hypophysectomy? Let's underline under intervention, craniotomy, you have in your package, and I wrote it down here, craniotomy and transsphenoid surgery. Everyone is okay so far? Now, I'm going to remove this, but what did I say in everyone I don't want you just to think, oh, we are studying endocrine. We got to connect all our system together because these are hormones is affecting our body. So what did I say? The first thing is pituitary gland, and I'm going to remove this now. And I will be going back and repeat it before I move because very important we understand. As soon as you will get the questions on is pituitary gland. Now everyone is okay, what is your pituitary gland is? Where is your pituitary gland? Where is your pituitary gland?
Master gland.
It's a master gland, but where is it?
In the brain.
In the brain. Very good. This is what is important. But remember, every question, patient is going for craniotomy. We got to remember is the pituitary gland is in the brain. Patient has head injury. What gland can be affected? Pituitary gland. Everyone is okay? So where is our pituitary gland? It's a master gland is in the brain, number one. Without that, we cannot move in our question. Where are the two parts of pituitary gland? Anterior and posterior. Remember everyone? What is anterior is affecting growth hormones. What is posterior? Very important, your ADH. What is ADH are? Antidiuretic hormones. I want you to write down there. You already did on the top where it says water absorption of the kidney. So posterior, when we are saying, I will be moving in the next page, but for now, we only talked about growth hormones. And I said, patient has hypo means shorter, hyper means is acromegaly. Everyone is okay so far? Hyper pituitary gland means is what? Patient is too big. What are the main care you will remember for patient with acromegaly are? Number one, safety, their eyes. I said chewing problem. Their hormones, all the hormones are high. Cardiac problem. We did under data collection. Then I went over on the treatment. So what is the treatment? If they're saying patient has hyperpituitarism, so remember the word what? Acromegaly. And what is the surgery is called to remove pituitary gland? What is the name of the surgery? Hypophysectomy. Everyone is okay? What is the word is removing pituitary gland? Hypophysectomy. Without that, you will not be able to do your question in endocrine system. So we must know the word pituitary gland is in the brain. And when pituitary gland is producing too much of hormone, either they're going to do radiation or they're going to remove the gland. The word is called hypophysectomy. If they give you a question, patient is admitted with hypophysectomy, that means is what? The patient, they have removed what? Pituitary gland. What is it going to be affecting pituitary gland more on your ADH? What is ADH is? Antidiuretic hormone. So I will move that on next page. But for this page, I want you to remember, how do we remove pituitary gland? We call transsphenoid. What is the word transsphenoid? Underline the word transsphenoid are through the nose. Craniotomy means through the cranium. Because the gland is up here, they can go through the nose, and that the word is called transsphenoid. If there is a question, patient has transsphenoid hypophysectomy, remember, you're going to monitor your patient from where? From nose. Where is the drainage is going to be? From the nose. What is craniotomy word? This is a cranium, and they're going to go through the cranium, and you will have a dressing here on a patient, and you're going to monitor for craniotomy. So remember, what is acromegaly? Are too much secretion of the pituitary gland, and person is having what? Acromegaly. What is the treatment for patient when they have too much of growth hormones or they have acromegaly? They will treat them with the drugs, which we wrote it down earlier, or patient is going for surgery. Everyone should know when there is a question, patient is removing for acromegaly, is surgery is called what? Hypophysectomy. Everyone is okay? What is hypophysectomy? Is removal of pituitary gland. 2 words. How do you remove pituitary gland? Number 1, transsphenoid or craniotomy. Everyone is okay so far. Now let's go. What would you monitor after patient is coming back from craniotomy or transsphenoid complication? It says underneath. First thing is, it's in the brain. Let's go back first thing to think. It's whether you're going through the nose or you're going through here. What is it going to affect the patient? Underline the word ICP, because it's in the brain. So whatever it is, surgery, whether here or here, what do you monitor your patient? I'm writing here is cerebral spinal fluid. Number 2, ICP. What is ICP? Is intracranial pressure. Now, if you think about, we are in endocrine, but your question can be ICP. What do you monitor? What is the first sign of ICP? How do you monitor ICP? Number 1, level of consciousness. I want you to write down. We got to connect our knowledge. What are we monitoring here? Level of consciousness. What else do you monitor for your patient? ICP. We are not done by saying, okay, I'm monitoring ICP. We got to know what are we doing in ICP. Number 1, level of consciousness. Everyone should know. What is number 2? Is pupil reaction. Write down the word pupil reaction. What is the meaning pupil reaction, or how the eyes are responding with the light? Are we clear? Are you going to monitor the pupil reaction for ICP? Yes. What is the third is vital sign. I want you to, I'm not doing endocrine, but we are talking in endocrine is what is ICP. Why? Because your pituitary gland is in the brain. So what are we monitoring in ICP are, everyone is okay. Number 1, level of consciousness. Number 2, your pupil reaction. Number 3, the vital sign. What are the vital signs for ICP are? I want you to write down increasing blood pressure. What is decreasing here? Pulse. What is decreasing here? Respiration. We are nurses. Patient returned back after hypophysectomy. We are monitoring ICP. What do we monitor in ICP are number 1, level of consciousness. Number 2 are what is your pupil reaction. And number 3, we are monitoring for what? Vital sign. We must know 3 things. And when I do neuro, I talk about the same thing. Second thing, underline the word, is it says bleeding and meningitis in craniotomy. Why? Because craniotomy is the cranium. We are touching the brain. If we do not maintain sterile technique, it can lead to meningitis. So what is the complication with craniotomy? You're looking here, ICP, bleeding, or meningitis, and add there cerebral spinal fluid. How do you know this is a cerebral spinal fluid? What do you know? And there may be question, patient has craniotomy, Patient come back and there is a dressing. How do you know it's a cerebral spinal fluid? Write down the word positive for sugar. And there may be a question, check for sugar. So write down the word for cerebral spinal fluid, everyone positive for sugar. Now there might be a question, and I'm going to explain here. I'm not only talking about the pages, but we got to connect it. That's the part. Patient is coming back, patient has craniotomy. We are monitoring ICP, we talked about. Number 2, if there is a question, you are changing the dressing and there is a fluid. What would you do? Never call the doctor right away. What do you do? Maybe reinforce the dressing. You don't remove the dressing. Maybe another answer for you. And what else may be? Monitor for sugar. Everyone is okay? Why? It will be positive if that is a cerebral spinal fluid. Now, if you're losing a lot of cerebral spinal fluid, you got to notify the physician. What is another thing you remember? Craniotomy can lead to what? Is infection. So everyone is okay? Craniotomy, ICP, level of consciousness. Number 2, you monitor for cerebral spinal fluid. And number 3, complications can be meningitis. If they're saying transphenoid word, and what did I say? You're removing the fluid and the dressing from the nose. Again, you're going to monitor for cerebral spinal fluid, positive for sugar. So post-op care, what do you monitor post-op care? Level of consciousness, number 1, from both of them. And monitor nasal drainage. And second line, underline the word cerebral spinal fluid. How do you know cerebral spinal fluid? For glucose. Second thing, very important, underline the word INO, because I will be talking, the next is ADH. And monitor ICP. How do you prevent your patient ICP not to go high? Prevent sneezing, coughing, and blowing nose. And also monitor for other hormones, because this is your master gland. Now there's no master gland, maybe monitor for steroids also, monitor for other hormones. So far we talked about removal of pituitary gland. Are we clear? What is the word is called? Hypophysectomy. How do we do pituitary gland removal? From the nose or from the craniotomy. Both of them, we are losing the fluid from the brain, is called cerebral spinal fluid. Everyone should know, and you must know. How do you know cerebral spinal fluid? Positive for sugar. Everyone is okay? Monitor the drainage. If it is a craniotomy question, and they're saying dressing is draining, what would you do? Never pick up answer to remove the dressing. Either you reinforce the dressing, or circle the dressing and monitor for positive for sugar. Why? Because you want to confirm is the fluid is cerebral spinal fluid. Everyone is okay? And how do you monitor is ICP? I already said level of consciousness, pupil reaction, and the vital sign. I will move on to the next page. And next page we must know is again your pituitary gland I'm talking. So I will talk about the posterior part of pituitary gland. What is the posterior part of the pituitary gland is called ADH. What is it producing? What is pituitary posterior is producing? ADH. Everyone highlight antidiuretic hormones. I will write it here and I will explain. Everyone should know posterior pituitary gland is producing what hormone? Very important, this pituitary gland for our exam and knowing our patients. What is posterior pituitary gland is producing? Antidiuretic hormones. What is antidiuretic hormones does? Where does it affect? Where does it affect antidiuretic hormone? Write down on their kidneys. Where is it affecting? Kidneys. We must understand first it's affecting on the kidneys. What is ADH does? antidiuretic hormones absorbing the urine in the kidney. So write down the word absorbing. What is ADH does? Absorbing. And what is it absorbing? The urine. What is kidney does? We filter the urine. And all the urine we are excreting out. But what happened after the kidneys filter the urine? ADH maintain the balance. And what is ADH does? Reabsorb the urine. Are we clear? What is ADH does? Where is it affecting ADH? On the kidney. And what is ADH is doing? Reabsorbing the urine. Now, so I'm going to talk about two diseases here, which is called diabetes insipidus and SID, because that goes in your pituitary gland. So let's see, ADH we have here. I already said what is ADH does affecting the kidney. So I'm writing diabetes insipidus. What is diabetes insipidus? Everyone should know. Disorder of what gland? Pituitary gland. Everyone is okay? So what happened in pituitary gland here in diabetes insipidus? They have low ADH. Very important word to know. What is low here? ADH. What is ADH is doing? I told you, absorbing back the urine. So what happened when you don't have enough ADH, antidiuretic? So your kidneys are filtering and filtering and filtering, and we are not holding the urine. So what is the word would call when patient will be peeing more is called polyuria. Everyone is okay. What is diabetes insipidus? Very important. We must know for your question, is a disorder of what gland? Pituitary gland. And what is pituitary gland is affected by ADH. Underline the word ADH is kidney fails to reabsorb the water, means urine. You can add there the word the urine. Patient will complain. What does the patient will complain here in diabetes insipidus? Only 2P, polyuria and polydipsia. Diabetic patient has 3 P's, but here we are talking about the fluid. So what does the patient has here? Polyuria and polydipsia. Only 2 things. So I'm writing here low ADH. What is patient is complaining here? Polyuria and polydipsia. Now tell me when patient pee more, what happened to the patient would be. Second word, remember, dehydration. Are we clear? You pee more, what does it cause your patient? Dehydration. Immediately, you think about diabetic patient, diabetes insipidus patient, what are you monitoring for? Dehydration. Why? Because they're losing a lot of fluid. So highlight the word dehydration. You got to memorize how you connect your question. Patient is dehydrated. Second thing you will go, what would be the urine? Always your questions are going to be, when patient pee more, your specific gravity is going to be low. So underline the word low urine specific gravity. Whenever you pee more, what would happen? Your urine is more diluted, more clear. So specific gravity is going to be low. I want everyone, remember how you will think. Polyuria, polydipsia, dehydration, a specific gravity is low. What are you losing when you pee more? Weight. What are you losing? The blood pressure. So highlight, remember the word low weight and low blood pressure. But when you lose more fluid, your concentration, very important word, is hypernatremia. Your sodium is high. Everyone must know for your NCLEX is sodium, and sodium is high, and that is called hypernatremia. You are losing a lot of fluid, patient feel very dizzy. Patient may feel fatigue, muscle pain, and weakness. And intervention. What do you do for your patient who is having this problem in intervention? Your medication are vasopressin, pitracin, Desmopressin, DDAVP is called, and can be given injection, can be given intranasal through nose or PO. Patient is peeing more. They are already having polyuria. What do we cut down here? Underline the word avoid food and fluids. Write down on the top or the side, coffee and tea, because that will also cause more diuresis, mean they will pee more. Your question may be, patient has diabetes insipidus, what would you avoid in the fluid? Maybe your coffee and tea, because they have more diuretic effects. And also, what would you monitor? INO, what you're going to monitor, weight, what are you going to monitor for your patient? A specific gravity. Safe environment, why? Because of hypotension. What else are you going to do? Give fluids. They need more fluids. So what are we increasing here? Fluids. What are we monitoring here? Vital sign. Let me repeat back here. And I want you to memorize. Now, endocrine, we always feel bad that we don't understand. But if you have simple understanding and you can do your questions better, you can take care of your patients better. Question are, what is diabetes insipidus? What is diabetes insipidus? Is disorder of what gland? Pituitary gland. What part of pituitary gland is producing ADH? Is from posterior pituitary. What is the function of ADH? Is reabsorbing the urine after the kidney filters. So what happens if you have less ADH? Your kidney will filter and you are not reabsorbing the urine. So what is diabetes insipidus? Remember, patient has what? Polyuria, polydipsia. Now think about when you pee more, what happened to the patient? What would happen to the patient? They are dehydrated. What would happen with dehydration? Question may be, monitor a specific gravity. What is the meaning here? Because when you have more urine, your specific gravity is going to be low. So that might be a question, what would be the specific gravity? What would be low? What would be the color of the urine if they ask you? What would be the color? Clear, yellow. It's not, when you pee less, urine would be concentrated. When you pee more, your urine color is very much yellow and clear. Next is, what happens when you lose a lot of fluid? You're losing weight, specific gravity is low. What about the blood pressure? Yes, what is the sign of when you get dehydrated? Shock, hypovolemic shock. What is the first sign of hypovolemia? Hypotension. Patient is losing weight, patient is having hypotension, patient has specific gravity. When you lose more fluid, your concentration of your salt is higher. Hypernatremia. What does it mean, hypernatremia? Patient can drink more water. Why? Because they're dehydrated. So what do you do for treat this patient are, number one, they're dehydrated, you give fluids. Everyone is okay? What do we give here? Fluids. What are you going to give the medication? We said vasopressin, drug, and pitocin, DDAVP. And what is the effect here? Is the affecting to cut down the urine output. So patient can reabsorb that water. And what are you monitoring patient here? Safety, vital sign, fluid, and maybe your answers are avoid the fluid, which are very high in what is like tea and coffee because it causes more diuresis. I will move on. Syndrome of inappropriate is called antidiuretic hormone. So what is the first disease? Diabetes insipidus. Second one is called SIADH. Two disorders of your pituitary gland. Another one is here. And what is here it says increase of ADH. What do they have here? Too much of ADH. Everyone is okay? Too much of ADH. Now what will happen if you have too much of ADH? What is ADH is doing? holding the fluid back. So what would happen here? They are holding more back the urine output. And what does it happen? Patient won't have enough urine output. So what would be? Low urinary output. Remember one word in a simple way, low urine output. Now what happens when you don't pee enough? Because it's holding back the fluid. Diabetes insipidus, you were losing more fluid. Why? Because they didn't have enough ADH. Now you have more ADH and patient is having what? Low urine output. Now what happens when you have low urine output? That means what? You are retaining fluid. I want you to underline where it says increase of ADH, add their low urine output. Add the word edema. And what does happen when you have low urine output? Write down two words. Low urine output, edema. Remember, when I will talk about ICP in neuro, but I'm going to tell you here, when you retain more fluid, we are going in what? Water intoxication. So it says the word water intoxication. What is the meaning? Water intoxication means cerebral edema. In the brain also, you're affecting that edema, and write down the word water intoxication, ICP. What happened here, the patient ICP is going high, is affecting the brain. And when you are retaining fluid, I want you to go back and think the same thing. What would happen to the patient when you have water fluid overload? Your sodium is low. You have a lot of water, your sodium is low, and patient is gaining weight, and your specific gravity is high, and patient vital sign, the blood pressure is high. Now what are you monitoring in ICP question here? When your ICP is high here, level of consciousness. Add there the word level of consciousness. And what do you prevent your patient when you have ICP here? Seizure. Some question may be, what are you monitoring here? Or seizure. What happened to prevent your patient from ICP? You are preventing them from seizure. See, you got to learn to connect. In the NCLEX exam, or when you're dealing with your patient, we don't have the books, but we got to connect our question and connect our theory. Let me repeat back here before I will move on to the next thing. What is SID-R? What is SID is the word is called syndrome of inappropriate antidiuretic hormone. What does it have here? Too much of ADH. What is too much of ADH is doing? Reabsorbing back the urine, and patient has what? Low urine output. What does it cause here is the edema. And what happens when you retain fluid? Anytime you're retaining fluid, always remember when I talk about neuro chapter, the word is called water intoxication. What are you monitoring for water intoxication? ICP. What are you monitoring in ICP? Level of consciousness. What are you preventing your patient here from seizure? Now you think another question. See how many questions we have. Now what do you monitor your patient here? What is it increasing here? A specific gravity. Urine is less, your gravity of the urine is going to be high. Patient is gaining weight here. Patient blood pressure goes high here. So remember, hypertension, weight gain, but very important two word here, hyponatremia and ICP. All your questions are going to be ICP and water retention that affect the water intoxication. Now what do you do if your patient has a syndrome of inappropriate antidiuretic hormone? Number one is safe environment. What kind of environment are we giving? Safe. Why? Because of ICP. Everyone is okay because of ICP. You are giving safe environment. Number two, level of consciousness. Why? Because of ICP. Level of consciousness. What are we monitoring? The weight. What are we monitoring here? Electrolytes. What is electrolyte? Sodium, potassium. What do you do here? Restrict the fluid. Patient is retaining more fluid. What do we give the medication? Here you give diuretics, underlined because they are retaining fluid. How do you treat them under intervention? Everyone should go on the second line is normal saline, and you can give them hypertonic saline, and next drug you have daclomycin, that is preventing from water reabsorption. What are we preventing? Water reabsorption. We are preventing them from water reabsorption. Let me repeat back here, and everyone, I want us not to think, we have a books, we think we know about pituitary gland. Now I'm repeating, we are only talking yet pituitary gland. And what did I say? Pituitary gland is where? In the brain. What is the pituitary gland? Has how many lobes? Two, anterior and posterior. What happened with anterior? Growth hormones. Either person is going to be dwarfism, hyperpituitarism means is acromegaly. What is the treatment for acromegaly? Surgery. And what is the name of the surgery? You're removing pituitary gland. Are we clear? And how do we remove the pituitary gland? Either you're going through the nose or you're going through the craniotomy. That goes only for acromegaly. Now I'm moving on posterior pituitary gland. So what is the growth hormones are? Dwarfism and acromegaly. Everyone is okay? And what is posterior gland has is affecting what hormone is called antidiuretic hormone. And what is antidiuretic hormone does? Reabsorb the urine back in the kidney. Now, if you have diabetes insipidus question, remember what happened to the patient here is low ADH. What is low ADH mean? They're not reabsorbing back the urine. So what are the, and they might give you a question, patient is admitted with diabetes insipidus, what would you monitor your patient? Polyuria, polydipsia. What happened when you have polyuria, polydipsia? Patient is going in what? Dehydration. When you lose fluid, what happened? You're losing weight. What is your urine specific gravity is going to be low. When you lose more urine, urine has a lot of urine, and the specific gravity of the urine would be low. What are you? Blood pressure would be low. Remember the word shock. And what is one thing we remember when you lose fluid, your sodium concentration is high. Now, what do you do for this patient? Number one, they're dehydrated. Are we going to give fluid? Yes. Now, you don't want to give coffee and tea. Why? Because they are more diuretics. Patient would pee more. That may be in a question in a diet. And what medication do you give? I said vasopressin and DDAVP. And that is in patient with diabetes insipidus. Everyone is okay? What is diabetes insipidus? You're losing more urine. What is low here? ADH. What is SID is? Syndrome of antidiuretic hormone means they have too much of what? ADH. And what is that would happen? Patient will pee less. So what would happen here? Low urine output. And when patient has low urine output, what are we retaining more? The fluid. And what is when you have more fluid? Either you're drinking or you are putting more fluid in the body. Patient is going always in your answers. And what are you monitoring? Patient is called water intoxication. What is the meaning water intoxication? They have cerebral edema because of the fluid. What are we monitoring patient here? Is ICP. What are we monitoring patient when we have water intoxication? Level of consciousness. What are you preventing here is from seizure. See how your questions are? They're not going to give you a straight. You got to connect it. And what would you do here? You don't want to. Do you want to give more fluid? No, they're retaining already fluid right away. Your questions are 90% on SID. What is SID? Because there is a retention of fluid. What do you cut down as a nurse? Fluid. Are you going to keep the water pitcher in patient's room? No. Are you going to teach your CNA not to give extra fluid? Yes, these are your questions. What do you monitor patient here is, remember, they're gaining weight. And what do they have? Their blood pressure is high. Urine specific gravity would be high. So remember, you pee more, your specific gravity is low. When you pee less, what is the word is called when you pee less? What is the word is called? Oliguria. Anuria. We got to know the terminology, because without terminology, we will not be able to do our questions. They're not going to say low urine output. What does the patient has here? Oliguria. And what is oliguria? Less urine output. And urea means none. So what do you monitor patient here is level of consciousness. So everyone, remember, this is not only one question here, many questions we have to do here. Is number one, sodium. Whenever you retain more sodium, remember you have more fluid already. You don't give fluid. When you have question, here you have hyponatremia. Hyponatremia is in diabetes insipidus. Hyponatremia means you're giving fluid. Hyponatremia means you're not giving fluid. What do you have here? In SID. Now, let me repeat here one question for all of us. And it will take a while, but you guys need to remember our pituitary gland has very important hormone is ADH. Your questions are going to be for ADH a lot, and also your ICP and sodium question. Now, let me go back, is question hypophysectomy. Now we already talked about all pituitary gland. Now I'm going back. Your questions are going to be, patient is admitted with hypophysectomy. What is hypophysectomy? Removal of pituitary gland. So think about, and don't go back and read, but let's see how we will answer your question. So where is pituitary gland? Is in the brain. Everyone is okay? And that is pituitary gland. And I said you're going transsphenoid or you're going craniotomy. What is the meaning transsphenoid? Through the nose, if they are using word. Craniotomy is on the cranium. Now let's see. Forget about all this. Let's go back. We are nurses. Patient is back with hypophysectomy. What do we do as a nurse? Number one, it's in the brain. So what do you monitor? Level of consciousness. So I would say monitor for ICP. Everyone is okay. Are you monitoring for ICP? Yes. Where is the pituitary gland? In the brain. What position do you put your patient after craniotomy or transsphenoid? Keep the patient on the back. When do you raise the head? If they give you a question, when your ICP goes up. Everyone is okay? Your question is, patient ICP is going up. What would you do? What would you do as a nurse? Remember, when ICP is high, I will do it in neuro, but we must connect. We cannot just memorize few things. What is ICP means? Level of consciousness. Now you think patient ICP is going up. Semi-Fowler's position. Only semi-Fowler's. What is the meaning? Semi-Fowler's, you raise the head of the bed. If you want to add it somewhere, I want you to add it, and I'm going to show you how many questions you can get for hypophysectomy. Because we must know our pituitary gland is in the brain, and anytime they're removing pituitary gland, number one is level of consciousness. What are you monitoring? ICP. What position do you keep? Just on the back, regular position. But if they give you a question, patient ICP is going up. What would you do now? Remember, what are you doing? Semi-Fowler's. That is your answer. And what is semi-Fowler's? 15 to 30 degrees, 45 degrees, not very high. Only the head you will raise. Do not touch their feet, do not touch. What did we highlight the word? Prevent coughing and sneezing. When you cough, you sneeze, and you are constipated, your ICP is going up. So maybe that answer is there. Prevent that. Now, let's go number 2. What would be on the dressing? The drainage. What drainage are we going to monitor here? Cerebral spinal fluid. What is in cerebral spinal fluid? We are looking and how? Positive for sugar. Everyone is okay? Positive for sugar. Number 3. We already talked about ICP and cerebral spinal fluid. Now what is in the pituitary gland we have? Everyone remember, what is pituitary gland? You don't have now. What would be affected? You remove the pituitary gland. What is not there in the body? What would be the hormone? ADH. Would you have ADH? No. So there is no ADH. Now what would patient would have? Low ADH or no ADH? What would patient would do? What was ADH was doing? Holding the urine. Now what will happen patient? Patient will turn into what? Diabetes insipidus. See how your questions are. So what are we monitoring? Maybe your answer monitor, diabetes insipidus. What does the patient would complain here? Polyuria, polydipsia. Can you give water? Maybe another question. Patient is admitted and patient has lot of polyuria. Patient wants to drink a lot of water. Can we give water to the patient? Yes. So can you give them in dehydration here? Yes. So what is diabetes insipidus? Dehydration. Remember that. Can you give water? Yes. Can you ask the water pitcher to be in the room? Yes. Your answer would be. So remember, another question. What do you monitor? They didn't ask you diabetes insipidus. And next question, urine output. Why? Because there is no ADH. After hypophysectomy, monitor urine output. Maybe, I know, maybe a specific gravity. Everyone is okay? What are we monitoring? A specific gravity. What would be the specific gravity when you pee more? Would be low. Are we okay? What would be the complication after craniotomy? Meningitis. Are we clear? So what is the complication of craniotomy would be? Number 5 is meningitis. Okay. Now what is SID is? What is SID? Syndrome of inappropriate. That has nothing to do with here. Everyone remember 2 words. Pituitary gland is in the brain. Any questions are going to be hypophysectomy. You are going to address your ADH. Don't forget that. Questions are going to be for diabetes insipidus, polyuria question can be there, specific gravity, level of consciousness, and craniotomy or transsphenoid, both surgery are done through the pituitary gland. Everyone is okay? Where is our pituitary gland is in the brain? What is it? Pituitary gland is responsible for growth hormones, and number 2 is what? ADH. What are the 2 diseases? We remember the word in diabetes insipidus and SID. What is diabetes insipidus? Polyuria. What is SID? They are retaining more fluid. When you retain more fluid, what do we monitor our patient here? For level of consciousness. What about sodium? Is low. What are they are retaining here? Is the fluid. Are they gaining weight? Yes, because they are retaining. And so remember how you are connecting. What do you do for this patient who's retaining fluid? The word is called water intoxication. What is the word water intoxication? You are monitoring is level of consciousness. Everyone is okay? How you are looking, the question on your pituitary gland, and your questions are going to be ADH. And where is ADH is affecting, I said, is in the kidneys and absorbing the urine. I will start now. The next on your page, next page you guys have is, we finish is pituitary gland. Now I'm moving adrenal gland. Where is our adrenal glands are? on the top of the kidney. What is adrenal gland is producing. See, if you know the main hormone, you know the main function, that is the endocrine, because endocrine is indirectly is all over in our system, so we got to know. So I'm going on adrenal gland. What is on adrenal gland? You guys highlight the word, is on the top of kidney. What does it maintain your adrenal gland? What is it maintaining is underline the word. You guys, in the next line, you have adrenal gland affects electrolytes. That's very important. And the last word, fight or flight response. What is the meaning? Fight and flight means the vital sign, the blood pressure, and write down the word vital sign, and electrolytes. When you will know the gland and you will know the function. What is adrenal? You can memorize as much as we want, but we must know we have two adrenal glands, and those adrenal glands are on the top of the kidneys. And what are those responsible for electrolytes? Very important are for all of us, we must know electrolytes, your sodium, your potassium, your calcium, your magnesium. These are your electrolytes. So what is it maintaining? I will be talking in adrenal gland are electrolytes. What is adrenal gland is responsible? I said highlight the word fight or flight. What is it maintaining? Your blood pressure. Any question come adrenalectomy, what are you going to monitor? The first thing you think about the vital sign. Second thing, the blood test. What is the test would be done? The electrolytes. I will move on adrenal cortex. There are two parts of adrenal gland. First, I will talk about the cortex. I want to remember the word cortex. So when I'm talking about cortex, is they're producing some hormones. What are those is adrenal cortex. You cannot move if you don't know these hormones. So we got to know. And underline the word glucocorticoid and mineral corticoid and androgens. Under adrenal cortex, highlight the word glucocorticoid, mineral corticoid, and number third is androgens. Everyone should know androgens. Glucocorticoid, mineral corticoid, and androgens are very important to know. And what is androgens are affecting on the sex hormones, glucocorticoid and corticoid or mineral corticoid are steroids. Everyone is okay? What is adrenal gland is producing? We all know the word steroids, right? But they may not give you the word steroids. And they might give you, patient is taking glucocorticoid. So what are you giving your patient? Glucocorticoid are steroids. And mineral corticoid and androgens. These are very important that these hormones are affecting on our body. Now what happened when you have adrenal cortex? Let's go first Addison disease. So I'm going on, there are two diseases in adrenal cortex I'm going over Addison. When we have question on Addison, Addison means low secretion of your steroids. Are we clear? What is Addison? Underline the word under Addison, low secretion of glucocorticoid and mineral corticoid. That means they don't have enough, what is another word for these hormones? We say steroids. Are we clear? So what do they have low here? Steroids. I want you to write down one more word. In 90% in your question, sometimes they will say they have low cortisol. Cortisol is steroid. So write down the word. We all should know steroids. Word we all know is cortisol. Question number 1. What is Addison disease? Our answer is low cortisol or low steroids or low glucocorticoid. That means the body does not have enough steroids. Everyone is okay? What is Addison? Everyone make sure we know the word cortisol, a steroid, glucocorticoid and mineral corticoid. Now, what do you monitor when your body does not have enough steroids? I'm going to write down like this. You do have in the wording is number one, everyone should know your sodium level is very low. And what else is low here is sugar. What is low here is the blood pressure. What is high here is potassium, and very high here is calcium. Now you guys have there low sodium, which is called hyponatremia. You have low sugar, means hypoglycemia, low blood pressure. And then second line, you have hyperkalemia and hypercalcemia. You got to memorize this. Whenever your questions are going to be, what is Addison? Number one, we have low steroids. Everyone is okay? And what is low are cortisol. What is low here? Sodium. What is low here? Sugar. Low blood pressure. What is high here? Potassium. Remember, I said your electrolytes. What are the electrolytes are here? Sodium, potassium, and calcium. What about the blood pressure? Is very low. Question number two, what do you monitor patient if you are coming or admitting with Addison? Your answer may be monitor the blood pressure. We are nurses. Why? Because their blood pressure is very low. What lab are you going to do? Electrolytes. What happened in electrolytes? Your sodium is very low. Your potassium is very high. And then you will highlight the word, how does their skin is, underline the word bronze skin. Pigmentation. Remember, Addison patients are losing weight. The skin is very important to know the skin is bronze skin, and also highlight the word they're losing weight and they get fatigue and GI disturbance. So what is Addison is low steroids, low cortisol. What would you teach your patient? Let's move on to the next page is intervention. What is the intervention here for your patient are monitor the vital sign, monitor the weight, monitor the blood glucose, monitor electrolytes. Why? Because they have very low salt. And how do you treat them? Underline the word, your answer for treatment, you're giving steroid, but they will give you is mineral corticoid. And I want you to add one more medication there. They give them Florinef or mineral corticoid. Remember, we said glucocorticoid, mineral. So how do you treat them? By giving us steroids. There may not be answer for steroids. There may be answer are mineral corticoid, because that is the steroid. Another medication, Florinef, that's a steroid, and I want you to 99%, you will see a lot of questions when you're going to do. How do you treat them? By giving mineral corticoid. What are you giving Addison patients are steroids. What are they lacking here? The steroids. Are we clear? So underline that word. Patient may need all their time the medication. What would you teach a patient who has Addison? Number one, in the second line, stress. What do you tell them? Avoid stress, because if they go in a stress, they're going for surgery, they can go into, in the second line in intervention, you have the word crisis. Addison crisis. I'm going here, the word Addison crisis is only patient who has very low or no steroids, they're going in a crisis. And which patient are going in crisis? Your adrenal gland and Addison patients. Now, what would you teach your patient here? Remember, avoid stress. Very important thing is avoid stress. I already said the skin is bronze color, and how you are treating them, you're giving a steroid. What do you teach your patient when you're giving us steroids? What do you teach your patient when you're giving us steroids are? What do we teach patient for steroids when you're giving? Do you stop all of a sudden? No. What do you do? Taper it down. If you don't taper it down, then what happened to the patient? They're going into what? Crisis. So remember, teach the patient. Number one, your teaching question, avoid stress. And what do you teach the patient here? Do not stop your medication all of a sudden. Are we clear? If they have to stop, they have to slow down with their medication. Because why? They're going into what? Crisis. Let me repeat before we take a break. I want to complete the Addison disease here, and then we will move on. After break is the crisis. But I want you to remember, what is adrenal gland are? What part of adrenal gland is? I said cortex. You've got to remember, is cortex, part of the cortex is producing what hormones here? We said glucocorticoid, mineralocorticoid, androgens. What is Addison disease is? Low steroids, low cortisol, low mineralocorticoid, any wording they can use it. How do you treat them? Remember, you are giving mineralocorticoid and Florinef. What do you teach Addison patient are? Avoid stress. Number one, if they go in stress, they're going in crisis. Number two, do not stop their medication. What is low here? Patient who's admitted with Addison disease, their blood pressure is low. What is low here? Remember one thing, they have very low sodium and sugar. What is high here? Potassium. Potassium is not good for the body, is affecting the heart. And so potassium level is high. So if they're going in a crisis, that means everything will get very much low sodium, potassium will go high, patient is going into crisis. So what are you treating with them? Are by giving a mineralocorticoid, and also you can treat them by giving Florinef. What is the skin for these patients are? A bronze skin. Are they losing weight? Yes. Cushing would be gaining up. I will talk about Cushing later. But Addison, everyone should remember, they have low steroids. Number one, their skin is a bronze color. They're losing weight. They have very low sodium, very low sugar, and potassium level is high. How do you treat them? You're giving them steroids. And what do you monitor if patient is going into crisis? Is called adrenal crisis. And I will stop here. We'll take a break, and then I'm going into Addison crisis and move on Cushing, all right?